Hi everyone, my name is Isabella Grippentrog, and I worked with Summerlee Brunn on this presentation about premenstrual dysphoric disorder. Just to give a quick introduction on what exactly premenstrual dysphoric disorder is, it's a type of premenstrual syndrome that can cause a decrease in overall function in the days leading up to a person's menstrual cycle with severe physical and behavioral symptoms. Symptoms begin prior to the start of the menstrual cycle and resolve when the menstrual period starts or within a few days of its start. So moving on to the etiology of premenstrual dysphoric disorder. So this disorder exclusively affects individuals who have a menstrual cycle, and symptoms of the disorder occur as a result of the onset of an individual's menstrual cycle. And obviously, with the menstrual cycle, there are accompanying hormonal changes, and this is the direct cause of the disorder. So, on to pathophysiology. Generally speaking, there's pretty sparse research on premenstrual dysphoric disorder, and there's not really a definitive single pathology for the disorder. But most researchers point to some sort of hormonal imbalance, and there's a few ways that this can occur. So the first is that an individual can have low levels of progesterone coupled with increased levels of estradiol. Um, Another one that could occur is disturbed aldosterone activity, which leads to sodium and water retention. And finally, there can be an imbalance in the hypophyseal pituitary adrenal axis. And then researchers have also seen that dietary deficits kind of correlate with having PMDD. So these specific dietary deficits include deficits in calcium, magnesium, and pyridoxine. And then environmental factors like stress can add to the symptoms of the disorder. So as for the prognosis for people who are diagnosed with premenstrual dysphoric disorder, generally prognosis can be good for people who seek some form of treatment, but it is a long-term disorder. And symptoms of PMDD will recur for as long as an individual has a menstrual cycle. So these symptoms will cease following menopause, which is usually around 50 years of age for most women, or if ovaries are removed in a process called an oophorectomy. But otherwise, the symptoms will continue to recur. And additionally, the prognosis can be better if the individual finds support and has someone to talk to, and if you find treatment options that work for you. So since PMDD has so many different etiologies, it's really important for these individuals to find their own treatment plan that really works for them in their specific case. So as for clinical course, I mentioned previously that PMDD does have a long-term course. The symptoms will resolve following menopause, or if they have their ovaries removed, but that menopause usually occurs around 50 years of age. Additionally, symptoms can stop for a temporary period of time if an individual becomes pregnant, because as long as you're not having the menstrual cycle, you're not going to have this disorder. Additionally, if an individual has PMDD in conjunction with other mental illnesses or disorder, there's likely to be greater severity of PMDD symptoms over time. So the specific disorder that this source cited was bipolar disorder, but there are other disorders that can add to this as well.
For the signs and symptoms for PMDD, they affect the mood, behavioral, and somatic aspects of people's life. So for the mood, people often experience feeling sad, depressed, hopeless, and worthless. They experience mood swings and increased irritability or anger, which leads to frequent conflicts with family and coworkers. They also experience increased anxiety and being on edge all the time. For the behavioral aspect, during this time they lack energy and they're easily fatigued, and they experience a decreased interest in normal activities. They have problems with concentration, and changes in appetite and sleep patterns occur. They experience somatic symptoms like breast swelling or tenderness, joint or muscle ache, a sensation of bloating or weight, and headaches. The general treatment for PMDD includes non-pharmacological treatments and pharmacological agents. Some of the non-pharmacological methods include exercise, which increases endorphins, so it is good for their mental health. They can also implement dietary modifications. The dietary modifications made will be ingesting more complex carbohydrates or proteins to increase ingestion of the amino acid tryptophan, because tryptophan leads to increased serotonin levels. They can also use stress management techniques such as breathing exercises. Some of the pharmacological agents are SRIs. These are proven to be effective in the treatment of severe mood and somatic symptoms, and benzodiazepines can help with individuals that have severe anxiety and premenstrual insomnia. They also have treatments such as suppression of ovulation, hormonal therapies, and oral contraceptive pills. Some of the ways in which occupational therapists can help in the treatment of PMDD is through relaxation therapy, where the client is taught relaxation techniques to bring about the body's natural relaxation response. They can develop energy conservation methods, such as asking for help with difficult tasks when they're not feeling well and simplifying tasks. They can also implement stress management techniques, and cognitive behavioral therapy has also been proved to be effective. Some of the stress management techniques that may be utilized are yoga, breathing exercises, and journaling. They can also work to develop strategies to alter lifestyle, such as stress management, balancing one's diet, and engaging in exercise. For community resources for PMDD, the website that is linked in the slide offers outside links that lead to Facebook support groups for people with PMDD, and they also offer a non-social media group forum that is available. They also have support groups through the website Inspire as well.